I want to talk to you about gestational diabetes. I've had it twice, 2012 and 2015. My sister's currently pregnant. She does not have gestational diabetes. My cousin, early in her pregnancy, tested negative for gestational diabetes, although she did have it in her first pregnancy. Here's the thing about gestational diabetes. It is a very complicated hormone-driven thing. My dad's got diabetes, his parents has diabetes, his siblings has diabetes. I'm also Vietnamese. The risk of getting gestational diabetes is very high in our population. I was not obese. I was not overweight. I ate very healthy. I got vegetables, fruits, rice, pasta. I didn't drink soda. Desserts. I was probably at high disposition for getting gestational diabetes because of my history, and probably have had prediabetes. The glucose test was very hard on my system. Probably insulin resistant. I cannot process sugar as well as some people, so my pancreas is working extra hard. It was also probably very strong hormones. That contributed to gestational diabetes. My older sister had to be on insulin to control her diabetes. I didn't have to be on insulin. I did use medication towards the end to control it because my fasting glucose was way off the charts. I had to keep a food journal. I had to prick my fingers at least 4 times a day. When I wake up for fasting, after the first meal, second meal, and third meal, 4 times. If I didn't get the numbers I want, I would have to test again. It's very, very hard to do this on your own. I did have nutritional class. They assigned me a nurse or a nutritionist that I had to give my food log to, be accountable for what I ate in case I have a high reading or whatever, so they can adjust the medication and things like that. I want to start a program to help women with gestational diabetes, especially women who are what you would call advanced maternal age. I got diagnosed at 32 and then again at 35, so I was at high risk. It was a very hard time for me because I was confused. I was scared. I didn't know what to do. Nobody really had any help for me. I felt very alone. My sister went through it and she gave me some pointers, but I, like many of the people, just kind of stuck to very boring diets that wouldn't affect my glucose. It was boring. I hated it. If I had known what I knew now, I would have been so much happier. If you're looking for support, a coach, a friend who's been through it all and understands your pain, let me help you.